Asthma talk number 3, who gets asthma and how can we predict who will get asthma and how bad an attack will be. Excuse me. We think there's a number of risk factors which, if they're present, mean that a person is more likely to get asthma. So from them are that people's genetics and family history may predispose them or make them more likely to get asthma. And this, excuse me, this increased sensitivity and irritability of the airways. We know that asthma also tends to affect people who are more overweight, so particularly when we have more than just simply overweight, we have obese patients. We know that they are more prone to getting asthma and getting asthma attacks. And we know also that the gender of the person makes a difference. So during childhood, boys have a higher risk of getting asthma. When we get to adulthood, then the opposite is true, and women have a slightly higher risk, or higher. There's more women, shall we say, that have asthma in a particular population than men. So those are things that are a little bit more difficult to control, with the exception of being overweight. Losing weight will help, but there are also things in the environment which can make us more likely to get asthma and asthma attacks. And those include things like certain allergic triggers, things outdoors, like pollen in the hay fever season. Indoor things include animals with fur, like dogs and cats, mold in the house, but also things like exposure to tobacco smoke. So not just if you smoke cigarettes yourself, but if you are in a house where someone smokes, what we call passive smoking. Pollution, we know, can make asthma worse, and even stress can bring on an asthma attack. So those are the kind of risk factors for getting asthma, and some of them are changeable and some of them are not changeable. We find also that people can get acute attacks of asthma very commonly from having a viral infection, a cough or a cold, which settles on the chest or which causes irritability of the chest. And therefore we are always on the lookout for people having a worsening of asthma or asthma symptoms at times of the year when we know that people are getting viral infections and coughs and colds.